speaking of stubborn, the containment numbers related to the transmission of COVID continue to be stubborn here in the state. And that's why it is important just to remind each and every one of you of what you already know, and that is COVID-19 will be with us for a long time, and we need to adapt. This idea that it was going to go away in the summer, during the warmer months, that somehow it would disappear based upon an assertion, a tweet, or a headline has obviously been substituted by a different reality that not only we're experiencing here in the state of California, but all across the nation. And so it's a sober reminder that what we will be announcing today in terms of our progress and in terms of our new strategies in terms of how we begin to modify our stay-at-home order, that we must deal with this reality and live with this fundamental truth until there is a vaccine, until we have the kind of therapeutics that could substantially mitigate the spread and the impact of COVID-19, that we will simply need to adapt our behaviors until that time. We're looking now to a uniform framework, one that provides 4 tiers. You'll be now hearing a lot about tiers, 4 tiers. There are colors attached to that. We'll get to that in a moment. 4 tiers, not 58 county variations as we've seen in the past. Process not only for tightening these restrictions, but also loosening these restrictions now are based upon these same metrics. The metrics that we assert are the most significant in terms of giving us a leading indicator of how things are taking shape in a particular part of the state are case rates and test positivity rates. Here's what we're looking at. We're looking at these 4 tiers, color-coded, making it a little simpler for folks, purple, red, orange, and yellow. We don't put up green because we don't believe that there is a green light that just says go back to the way things were or back to the pre-pandemic mindset. Quite the contrary. These are the guidelines, these color-coded county guidelines that we're putting forward to get us through this flu season, to prepare for the upcoming flu season, this twindemic as sorts, as we deal with flu and we deal with COVID-19, to work through the next few months here in the state of California. Again, this is a dynamic process. It's an iterative process. We are not stubborn in terms of an ideological thrust. It's the work we're doing and the considerations that we make in real time with experts and county health officers and members of respected industries and members of the public that provide guidance and feedback. But the guidance and feedback we have received that helped us put this in place, we have advanced and engaging in seeking that guidance and collecting that guidance over the course of many, many weeks to put together the chart that you see in front of us. The purple part of this, the risk level, we refer to as the county risk level as with spread, is what commonly was referred to in the past as the old monitoring list, the old watch list that you may have seen in the past. New cases that are more than 7 per 100,000, which, by the way, that's a daily case rate. It works out to be roughly exactly the old case rate of 100 per 100,000 we had for a 14-day period, 98. So that's what the 7 represents. We just want more specificity, looking at daily rates, not just that 14-day rate. So no more, or rather more than 7 rates, new cases per 100,000 population, and those with positivity rates north of 8%. You'll see where the state of California is. We're closer to 6% over the last 2-week period. But if you're in a county with more than 8%, you would be on that purple list. If you have a number of new cases that are more than 7 per 100,000 population, you would remain on that purple tiered list. The new sectors now, 3 tiers, as we refer to them in these new guidelines. The red tier is substantial spread. That's reflected 4 to 7 cases, new cases per 100,000, and positivity rates that drop below 8% and put us above 5%, so 5 to 8%. The moderate represented in orange, and there are a number of counties in that category today. I'll provide that list in just a moment. Those are with new cases, case rates below 4 per 100,000, 1 to 3.9, and you see positivity rates that get up to 4.9%, below 5%. And then, of course, minimal, that's the category, this yellow category. We have less than 1 new case per 100,000, and less than 2% of people that are test positive for COVID-19. One thing we've learned from the previous reopening experience, something I'm asked all the time about: what is the experience you had in the past? What are you incorporating in terms of new considerations in this new approach? One of the things is making sure that we really hold strongly to these buffers in terms of criteria and data, and holding that criteria and data in line for an extended period of time in each tier. In order to move out of those tiers, there's now a 21-day mandatory wait time, 21 days. When we did this the last time, Dr. Galley will talk a little bit more specifically about our experience in terms of the health orders we put out. We put out guidelines. They didn't mean go, but we empowered the counties to make decisions based upon attestations and partnerships that had to form with county health officers, signing off with county officials on their ability to move. We're going to be more stubborn this time and have a mandatory wait time between moves. We didn't do that last time, and that is a significant distinction between what we've learned from the past and what we now are advancing in this more stringent, but we believe more steady approach to moving counties within tiers and modifying the activities within those respective counties.